Hi, everybody. It's Dr. Eric Balcavage. We're back with another edition of the Thyroid Answers podcast. I'm here with my co-host, Dr. Erica Riggleman, and we are going to talk about Hashimoto's today.
Yeah.
What causes it, what it is, how you identify it, why it's important, and some things that you can do to improve your health and improve your Hashimoto's condition, maybe even without seeing a functional medicine doctor right off the bat. Okay.
Absolutely.
So, Dr. Erica, why don't you give our listeners a little background on what is Hashimoto's thyroiditis?
Okay. Well, Hashimoto's is an autoimmune disease, similar to another autoimmune disease in the body would be things like MS, lupus, rheumatoid arthritis, where the immune system turns on your own tissues. So instead of recognizing so in this case, your thyroid as being self, it's actually recognizing the thyroid as being a foreign body. So with anything being foreign in the body, the immune system is then going to attack it. It's going to mark it, tag it, and then anytime your body is inflamed or aggravated, if you will, the immune system is then going to go and attack the thyroid. So a lot of Hashimoto's patients are going to have symptoms of hyper and hypo. It's because you're getting that destruction, which dumps a lot of thyroid hormone into the system, can give you that hyper symptom. But then in the meantime, since the cells were destroyed, you may then swing back into the hypo category.
Okay. So let me summarize. So we make sure we got that. Hashimoto's your immune system's attacking your thyroid gland.
Yep.
When you have Hashimoto's, your body is producing these antibodies that bind to thyroid-based tissues and start to create some destruction of the thyroid gland, right?
Yeah, absolutely.
And so from a medical standpoint or from a patient standpoint, how do you identify? What do doctors do to identify that you actually have Hashimoto's?
Well, the funny thing is most doctors aren't really testing for Hashimoto's to begin with, but if they do, they're going to run an antibody test to see, do you have the antibodies against thyroid tissues in your body?
And those antibodies would be TPO, thyroid peroxidase antibodies, and thyroglobulin antibodies.
Yep. Mm-hmm.
And so for those of you that are listening, the reason there's an importance to what's going on here. Most of the cases of hypothyroidism, it's believed that greater than 90% of the cases of hypothyroidism are caused by an autoimmune attack, Hashimoto's. So if 90% of the cases or more are caused by Hashimoto's, then it's probably an important thing to evaluate. The big issue is in traditional medicine, some people don't test for it. Matter of fact, most often it's not tested for unless you have somebody who's a little bit more functional medicine inclined. Mm-hmm. But for even the people that know the statistics that 90% of the cases of hypothyroidism are caused by an autoimmune attack, the reason thyroid antibodies aren't done is because it's believed that there's nothing that can be done anyway. Mm-hmm. Most of the cases are caused by Hashimoto's or an autoimmune attack, and we can't. In traditional medicine, it's believed that you can't do anything about the autoimmune system, so we're just going to give thyroid hormone because the immune system is going to eventually destroy the gland totally, and it's not a big deal because we can take the gland out, we can irradiate the gland, we can totally remove it and just give you T4 and T3, and primarily T4, and you're going to be good. As long as we give you T4, you don't need a thyroid gland. And that's kind of the thought process in traditional medicine is it doesn't matter.
Yeah.
The immune system is going to destroy the tissue anyway. We can't stop it, so why do the testing for it?
And that's often quite sad that I've had patients come to me and say, well, what we're going to do, the treatment for Hashimoto's for you is going to be, we're going to wait till your body destroys enough of your thyroid, then we're just going to remove it.
Right. That's not good either, right?
No.
So there's a couple issues with that thought process. One is that if 90% of the greater of the cases of hypothyroidism are an autoimmune attack, it's the reason the gland is being destroyed is from an immune response. Mm-hmm. And so focus should really be on shifting as to what's causing the immune response or the autoimmune response. And if we correct that, then we can actually help a person reduce the damage that occurs to their thyroid and potentially save their thyroid gland. If we don't, then there will be unlimited destruction of the thyroid gland, and they will become a slave to thyroid hormone for the rest of their life. And that you don't have to be a person who needs thyroid hormone if you have Hashimoto's. I know I have Hashimoto's. I don't need thyroid hormone. My values are within normal range. I feel good. I feel fine. I'm able to control that. So it's not a death sentence as far as your thyroid gland if you are diagnosed with Hashimoto's. It comes down to identifying what's the root cause. And the place to start is by looking to find out if you have an immune or an autoimmune process going on. You have to run those thyroid antibodies to identify if it's an immune process. If it's an immune process, the gland is just one of the tissues that the immune system can wind up attacking. What some of the research shows that if they don't address the underlying cause of their immune attack or immune response, within 3 to 5 years of having the first autoimmune diagnosis, they're more than likely to have another one. And so the immune system will continue to keep attacking tissues. It's not going to stop at the thyroid tissue. And that's a big concern. In traditional medicine or allopathic medicine, they consider that all of these different disease processes are separate things, when in reality, they're all rooted in the same thing: chronic immune, chronic inflammatory issues that trigger this autoimmune response. So in our world, in the functional medicine world, it's critically important to identify whether it's an immune or autoimmune process. Because if it's not, then we need to look at different things. Is it just that the gland can't make thyroid hormone? And there are those cases where there's damage to the thyroid gland, or there's iodine deficiency, or there's maybe some toxins that are blocking the production of thyroid hormone. But the vast majority of cases are autoimmune.
Absolutely.
So they have to start looking at thyroid antibodies if you want to figure out what to do. So to identify Hashimoto's, which is this autoimmune response, get the full thyroid panel done with TPO and thyroid globulin antibodies.
Absolutely. And I make a big distinction when my patients come into me, and we need to figure out whether we truly have a thyroid issue or if we have an immune system issue, or both. Because oftentimes they do have a combination of both. But if you're not taking this from an immune system approach, if they do have Hashimoto's, you're gonna miss everything. You're not gonna be able to get them to where they want to be health-wise. And then, like you said, down the road, it's just going to pick another tissue. And what happens if that tissue is your nerves or your brain? And, eventually you start to eat away at your myelin, and then you develop MS down the road. I mean, you can develop some pretty life-altering autoimmune diseases if you let that system just progressively get worse.
Yeah, and I have a patient, a great lady, developed hypothyroidism. We talked about the fact that she should really identify whether it was autoimmune or not. She's like, I feel good with the T4, I'm good. So let's at least find out. Ask your doctor to run thyroid antibodies next time. Next time she had her blood work drawn, her primary care or endocrinologist ran the thyroid antibodies, and sure enough, they're positive. And I said, listen, this is an autoimmune condition. You're giving enough thyroid hormone right now to support your needs, but you haven't identified what's causing the autoimmune attack. So the chances of having another autoimmune condition in the next 3 to 5 years is pretty good. She's like, I feel good. I'm not really that concerned. She looked great, lean, fit. She looked fine. And it was about 3 to 4 years later that she came into the office and wasn't feeling good. She was chronically tired and fatigued. And I recommended that she have her blood work redrawn. We ran a hemoglobin A1C along with it. We ran a comprehensive metabolic panel, but on that was hemoglobin A1C. And sure enough, her hemoglobin A1C she was in the diabetic range. And so she's like, oh my gosh, got diabetes. I'm like, yeah, but you have to take this one step further, and we're going to run some antibodies to find out if it's an autoimmune condition. And so sure enough, her antibodies came back that she's got LADA, latent autoimmune diabetes onset in adults. And so this was her second autoimmune condition and disorder, and it was within that 5-year time frame. So now, because she didn't address the underlying immune response, not only does she have Hashimoto's, she also has type 1 diabetes, and she needs insulin to control blood sugar levels. Now, is she going to change anything? Is she going to go out address those things? She hasn't yet. So within the next 3 to 5 years, I'm sure we'll see another immune or autoimmune process occurring. So it's just a shame. It really is. And her doctors, just her medical doctors just are not aware. They're thinking that her diabetes was just a totally separate condition that was caused because somebody else in her family has diabetes and it's genetic. And that's just not the case.
Yeah.
So let's talk about causes. So what would you tell people are the primary cause or causes of Hashimoto's, this immune or autoimmune attack on the thyroid tissue?
Well, you want to figure out what's actually triggering the immune system, and I would say that since 70 to 80% of your immune system resides in your digestive tract, that's usually the first place I look for the development of autoimmune disease is, what's the status of your digestive tract? Do we have leaky gut? Do we have some sort of overgrowth? That's the number one place. There's other things, but that digestive tract is that first and foremost. Whether you have a physical trauma, let's say like a head concussion, they say within 30 minutes of having a concussion, you can develop leaky gut, which then can initiate an autoimmune response. So different things, whether it's a physical, emotional, or chemical stress in the body can affect the gut and the status of it, which then can lead to the autoimmune because there's so much of the immune tissue in the gut itself.
Yeah, at the root of every immune or autoimmune process is essentially a chronic stress, chronic inflammatory process. Mm-hmm. And we've talked about the cell danger response before. And just for most people, it's just excessive, chronic, exaggerated stress response over time. Sometimes we see that people develop autoimmune processes after some acute stressor, mm-hmm. second pregnancy, divorce, somebody died, an accident, an injury, concussion, something like that. And some type of physical stressor could be it. Some type of chemical exposure is enough of a stress that can trigger an immune or autoimmune response. Emotional triggers can definitely create chronic stress and trigger immune and autoimmune conditions. And then the microbes, and the microbes are huge, and especially for the thyroid because of the uniqueness of the gut and the immune system and the direct flow of lymph tissue directly into the thyroid tissue makes the thyroid gland very, very susceptible to chronic infection. And the thyroid cells in themselves can mount their own cell danger response without the need of the immune system. So they can really mount this immune attack or the cell danger response and really trigger the autoimmune process to start to occur. Hashimoto's is the most common autoimmune condition in the U.S., and I would say in the vast majority of cases that microbes probably play a major, major role in what's triggering the immune and the autoimmune response.
Absolutely.
I've read a bunch of papers, number of papers in the last year, which tie things like Klebsiella and Citrobacter to autoimmune attack or triggering the autoimmune attack in the gland. They've actually found those bacteria in the thyroid tissue. And so they know that these bacteria can be part of the trigger, part of the cause. And a big piece of the problem is in allopathic medicine, those are considered normal flora. They're not normally considered to be problematic, but the research does show, especially things like Klebsiella, Pseudomonas, Citrobacter, these are not only opportunistic bacteria, but opportunistic bacteria that can trigger autoimmune disorders. So I totally agree with you that the vast majority of people that have Hashimoto's should probably look at their GI tract as the root or the source of a lot of their problem. Two routes of entry of organisms into the system, oral cavity and gut. And so those are two key areas that you have to look at if you've got any type of chronic inflammatory, chronic immune process going on, right?
Mm-hmm. Yeah, and then going along with the gut, the food triggers, the foods that could create leaky gut or even have an entry from the digestive tract to create an immune response against the thyroid. A lot of studies show that gluten and dairy has what's called molecular mimicry that look very similar to your thyroid. So if you already have antibodies against your thyroid and you consume things like gluten and dairy, that when you eat it, your body thinks that that's actually a thyroid tissue, will actually create and mount that immune response.
Right. And so if somebody wanted to find out if they have Hashimoto's, we definitely would want them to get a full thyroid panel. We'd want them to make sure they have thyroid antibodies. We'd want them to make sure that they don't just check their thyroid antibodies on one test, but on multiple tests, because it may take a couple times of testing before you actually see the antibodies show up. Because for some people, there's two halves to the immune system, the Th1 side of the immune system, the Th2 side. The Th1 side is typically upregulated in cases of Hashimoto's, which means that they don't make that many antibodies. So they can have Hashimoto's, but their antibodies be negative. So they need to make sure they run it a couple times. But then once you identify it, then you got to look at some testing to determine, all right, what's causing it? Things like an organic acid test or an amino acid test, right?
Yep. Or a GI mapping test is a really great one to be looking at the gut pathogens to really see, do you have overgrowth? Do we have parasites? What's going on inside that digestive tract that could be triggering that immune system?
Right. And it may not be gluten, but you could have lots of inflammation in the GI tract from medications you take, from alcohol you take, just from lots of processed carbohydrates and sugars that you put into the body that can lead to overgrowth of yeast and bacteria and viruses and parasites. So the GI map or organic acid testing is really important. The other thing is really important is how do people kind of get a clue or a hint that maybe they should, if their doctor says, well, it doesn't matter, what are some clues that somebody might want to investigate whether they have Hashimoto's further, or what are some clues that may give somebody the idea that maybe I do have Hashimoto's and I need to push to get it done from a symptomatology standpoint? What would you tell somebody?
I mean, if you're on both sides, like you have dry skin, you're overweight, but then you also have heart racing, you may have panic attacks, you may be having both symptoms of hyper and hypo, that's like a classic sign to me that, we should probably run some antibodies to rule that in or out. The other one is if you've been hypothyroid for many years and your dosage of your medication is constantly changing because maybe your TSH is going sky high one visit, then it's going low and you're going back and forth, that's usually another indication that, okay, there's something else going on, that TSH shouldn't be bouncing around that much. It's not that 1 month you need this much Synthroid and the next month you don't need that much Synthroid. There's usually an indication that something is going on and it might be autoimmune based.
So if they have symptoms of hypo and hyperthyroidism, if their lab values seem to fluctuate quite a bit, if their doctor's always trying to tinker with the right dose, I have to increase it, decrease it, or if they're finding that they have to switch medications. Okay, levothyroxine worked for a bit, now it doesn't work, so now I'm going to try this form, or I'm going to try Cytomel, or I'm going to try Nature-Throid. And they're going through these different forms of thyroid hormone support, and they just nothing seems to last for an extended period of time of working well. That too is another indication that they may have Hashimoto's, this autoimmune attack. Another possibility is if they have other autoimmune conditions, they really have to consider that they may have Hashimoto's, because Hashimoto's in the U.S. is the most common cause of hypothyroidism. So if there's another autoimmune condition that you've identified, there's a really good chance that what's going on with your thyroid physiology is an autoimmune process occurring, or it's in process.
Yeah, absolutely.
So if somebody wanted to work on trying to help themselves, they've convinced their doctor that they want a full thyroid panel done, they've found out that their thyroid antibodies are positive, besides coming to see a functional medicine practitioner like you or I, what are some of the things that you would recommend they do right off the bat to start improving their health and their well-being, even before they come see a functional medicine practitioner?
Well, I would first and foremost be getting off gluten and dairy to get off the common triggers that can create issues with the thyroid. And then I'd start working on your digestive function, maybe taking some probiotics, taking some glutamate-based products to help heal the leaky gut, just to improve overall gut function. and then working from the stress response, maybe try and find ways to lower your emotional and physical stress in your body, working on, just reducing your overall burden in your system. So toxins that you may be exposed to, just overall working on lessening the burden that's going on in the body.
Okay. So diet is really important, and we'd say a gluten-free, dairy-free diet right off the bat. For most people, they can look and Google an autoimmune, anti-inflammatory diet, and you'll see lots of resources for that on the web. But essentially what I try and get my patients to do, and I know you do as well, is get them to work on a blend of kind of a vegetarian / paleo diet.
Yep.
If those things got together and married, it would be focused on that. So they really, not just do they want to be gluten-free, dairy-free, but get the processed carbohydrates and grains down, because they are inflammatory. They have a tendency to feed the gut bacteria if you have dysbiosis. And what most people start to find is that if being gluten-free and dairy-free isn't good enough.
Yep.
That is, just because you remove those things doesn't mean you fix the damage, the inflammation, got rid of the dysbiosis in the GI tract. So you want to be really good in the beginning with not just reintroducing a bunch of other gluten-free grain products, because those things will still feed the organisms. And all of those grain products potentially have gluten-like compounds in them that your body can start to have that molecular mimicry to. But definitely improving diet becomes a major, major issue.
Absolutely. And there are autoimmune paleo cookbooks, and there's autoimmune paleo Facebook groups out there for people who have autoimmune disease across the board for support. So you can go on there and find recipes. They've got that broken down into foods that you should and should not eat. So there's a big support group out there for autoimmune paleo for patients who maybe aren't ready to take that step forward to work with a functional medicine practitioner, that they can actually get some support online with some of those recipes and introing into that diet.
Yeah, and then the other things that you kind of hinted towards, one of those is start working on improved sleep quality. Because sleep plays a major, major role in your body's ability to heal and repair. So if you're not sleeping well, that becomes a major issue to start to address. So work on sleep patterns. The other thing is, especially if you've got the potential to have some gut-based dysbiosis going on, is to whatever level you can start working on increasing your physical activity, especially things like low heart rate or normal heart rate cardiovascular work and strength training. Yeah. Exercise, if you're capable or able to do it. You can't do it excessively, but if you can start to do some increased activity and even some strength training once or twice a week, you can improve the health of your GI tract by just exercising and doing physical activity. So those would be things to do. Look at your relationships. What are the things that are creating the most stress in your life? And neither one of us is a psychologist or a psychiatrist, but we would both say that if you have a lot of emotional stress in your life, you have to address that. One of the biggest things that creates chronic inflammation, and a lot of people have a hard time believing that, but I usually say to them, if I put you in a group, in front of a crowd of 1,000 people to speak to, what would you feel like? Well, and most people would be like, I would be nervous. I'd have to go to the bathroom. I may want to throw up. Right. That is emotional changes, changing your physiology. Yeah. And so if you have negative thoughts, if you have problems with your family members, your friends, your spouse, your kids that are just overwhelming you, and you have no way to get rid of that stress or deal with that stress appropriately, that is enough to trigger a chronic stress and an inflammatory response in the body that can trigger an autoimmune process. So deal with whatever the life stressors you have. Clean up diet. Work on supporting a healthy GI tract. Improve your quality of sleep. And definitely work on what's going on from an emotional standpoint in your life. If you're still mad at mom and dad from 10 years ago, get over it. You may not like them, but get over it, move on. And then lastly, do what you can from a physical standpoint to improve your physical health. I understand a lot of people are like, well, I'm tired, I'm exhausted, I don't have any energy. I can't go for a 60-minute workout every day. Well, we're not asking you to do that, but just start doing what you can and then give yourself time for recovery. You're not going to necessarily exercise your way out of a thyroid problem or an autoimmune condition, but in doing some level of activity can definitely help you with sleep, with recovery, and reducing the bad bacteria that's in your GI tract.
Absolutely. And then when they're ready to move forward and they want to actually work with someone, finding a functional medicine doctor out there to help, maybe help uncover what your exact triggers are. I mean, because that's number one key is you want to figure out what your trigger is to the autoimmunity, because if you can figure out what those triggers are, you can help keep that immune system at bay so that you're not, flaring up your thyroid, but you're also not going to have the potential to develop something later down the road.
Yeah, and I'm a great example of that. I was surprised and shocked when I realized that I had an autoimmune thyroid condition, and I'm taking care of other people and not paying attention to my own health. And part of my stressor wasn't diet. It wasn't necessarily, to some degree, maybe lifestyle, because I'm up early trying to do a lot of study and research and maybe not getting to bed as early as I should have. So sleep quality was definitely impacted. But for me, I fully believe that my main trigger was how I was exercising. And so in my pursuit of endurance, to become a better endurance athlete, I was training inappropriately, putting more stress on my body, creating this insulin resistant state, not allowing for appropriate recovery, and wound up triggering my autoimmune problems. And I should have been aware of that on myself, but it's hard when you're an athlete to say, I need to do less.
Yeah, it is.
And I could get away with it maybe when I was 20 and 30, but now at nearly 50, my body just does not recover. So I had to back away from that. And then in the process of changing how I exercise and train, my insulin resistance goes away, and I do have thyroid antibodies, but my thyroid physiology is fine, and I want to keep it that way. So you have to identify those triggers, and you, as our listeners, as lay people, may not be able to figure all that out, but that's what we do in functional medicine, is really help people understand what's creating the problem and seeing things that they can't necessarily see for themselves.
Absolutely.
So any final thoughts on today's podcast?
If you're not diagnosed with Hashimoto's yet and you have thyroid issues, ruling that in or out, and then, if it is negative, don't take that as the final thing that you don't have it. Getting it tested a couple times, and then if you do have it, take some of these tips and, run with them. And then if you're still struggling, that's the time where you need to sit down and it's that fork in the road that maybe you need to have somebody take a new perspective at it. That might be a functional medicine doctor and getting you to that optimal wellness.
Great. And it could be Dr. Eric, could be myself. It could be somebody else who's a functional medicine practitioner and really focuses on thyroid physiology.
Absolutely.
So we'll kind of finish with that. Dr. Erica, let everybody know where they can get a hold of you again.
Brain and Body Health Center on Facebook. And we just changed our Instagram and Twitter, and I'm not really exact. It's Doctors Riggleman. That's what it is. We just changed it. So that's a little note that it's a little change in the last week. But then, Brain and Body Health Center at Facebook is the other way to get a hold of us.
Awesome. And you can always find me at chronicconditionrecoverycenter.com or thyroidproblemsdoctor.com. Those are my two main websites. And if you have any questions or concerns, you can reach out to my office through either one of those websites for a consultation, or you can call for an appointment. So Absolutely. That's the end of today's podcast. Dr. Erica, always good to have these discussions with you. Absolutely. And we'll plan for another podcast in the upcoming weeks. Okay?
Absolutely. Sounds good. All right.
Have a great weekend.